Hello and welcome to Clinical Exam Series with Dr. Puddle. In this video, we're going to be discussing abdominal examination. There are two aspects of this video. The first part will tell you how to carry out the examination, and the second part, we're going to demonstrate abdominal examination within the 3 minutes time frame. In your OSCEs, you usually have about 3 to 5 minutes to carry out your examinations. However, we'll use 3 minutes to be on the safe side. Whenever you want to carry out physical examinations, make sure to greet the patient. Make sure to obtain informed consent from the patient. Establish some form of rapport by assuring the patient that you are not going to inflict any pain. If there are any PPEs around the patient, like your gloves, make sure you use it when you are carrying out the examination. Lastly, you need to screen the patient before you expose the patient. Always stand at the right-hand side of the bed. If you are left-handed, make sure you inform the examiner before you start your examination. When we're examining the abdomen, we always position the patient in the supine position. The first step is to inspect the abdomen, and you need to be elaborate here. Squat and make sure your eye level is at the level of the abdomen. Go to the foot of the bed and see the rising and the falling of the abdomen. Make the inspection as elaborate as possible, what we call showmanship. Now, light palpation is carried out by palpating lightly in the 9 quadrants of the abdomen. Before light palpation, ask if the patient has any pain in the abdomen, and if there is pain, start from the farthest point from the point of pain and examine the point of pain last and very briefly. Next is deep palpation. When we're doing deep palpation, we're looking for organomegally, organ enlargement. So we check for the liver, we check for the spleen. Also, when we're doing deep palpation, that is the point where we do balloting of the kidneys on both sides. Next is percussion, and in percussion, we're going to be checking for the liver span as well as the splenic span. We're also going to be listening for percussion notes. It is usually dull on the surface of the liver and the spleen, and is tympanic in the rest of the abdomen. The next step is to demonstrate for ascitis. When we demonstrate for ascitis, we can use 3 maneuvers. The first is shifting dullness. The second is fluid thrill. The third, which you should never do, is the Puddle sign. Know it in theory, but do not carry it out in the examination. The fourth aspect is to auscultate the abdomen. When we're auscultating, we're going to listen for the hepatic bruit, the renal bruit, the aortic bruit, and lastly, the Bowel sounds. Now, all these we have been doing as the patient is lying supine. Now, the next aspect, we're going to ask the patient to sit up so that we can examine the back of the patient. Here, we're going to be checking for renal angle tenderness as well as sacral edema. Don't forget, the last step in every physical examination is to thank the patient and cover the patient. The next clip is going to show you how to carry out abdominal examination with 3 minutes as our reference.